Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show.
I'm John Strum, and this is RealTalk MS. It's May 14th, and we have a lot to talk about. Last week, I was at the American Academy of Neurology annual meeting in Philadelphia, and if you haven't had a chance yet, you might want to check out the daily 10-minute RealTalk MS updates that I put out from the conference. Like so many other things in our world, technology is fundamentally changing the way that neurology is practiced, and bigger changes are already on the horizon. If you're able to check out some of those updates from the AAN meeting, I think you'll gain a small peek at the future. And besides reminding you to check out our updates from the AAN annual meeting, I want to let you know that in addition to Apple Podcasts, Google Podcasts, Spotify, and Stitcher, you can now find RealTalk MS on Pandora. So no matter where or how you like to get your music and podcasts, you'll find all the episodes of RealTalk MS wherever you look for audio content. And for those of you who don't necessarily enjoy hunting around for audio content, I know that some of you have shared with me that you're not really into podcasts, and RealTalk MS is the only podcast that you're listening to. Well, you might find it easier to simply download the RealTalk MS app for your Apple iPhone or Android smartphone. You'll find the app at the Apple App Store or the Google Play Store. It's free, and once you have the app, you'll never have to think about how or where to download the latest RealTalk MS podcast episode. But no matter how you choose to listen, I'm glad that you've chosen to be a part of the RealTalk MS listener community. I see RealTalk MS as a conversation between us and among us. So thank you for being a part of our conversation. And please don't forget, you can be my special guest on the 100th episode of RealTalk MS. This is episode number 89, and our 100th episode will be here before you know it. So if you have a story about your MS journey or an interesting perspective on MS that you'd like to share, then maybe you and I should talk. All you have to do is visit realtalkms.com/enter, and I'll include that link in today's show notes, and then share some information about what you'd like to talk about during our interview. You have until May 31st to get your entry in. I'll announce the episode 100 special guest winner on the June 4th episode of RealTalk MS, and then we'll schedule a time for our interview so that you can share the story of your MS journey. So consider this your invitation to head over to realtalkms.com/enter and let me know what you'd like to talk about on the podcast. And speaking of a topic that you'd like to talk more about, back in February, Dr. Deborah Backus from the Shepherd Center was my guest on the podcast, and we talked about the importance of physical rehabilitation for people living with MS. Well, since then, I've received a lot of listener email about rehab for MS, and a question that keeps popping up is, what about people with progressive MS? Can they benefit from rehab? Should they be exercising? That's why I'm happy to welcome Dr. Lara Pilutti as my guest today. Dr. Pilutti is an expert in the role of exercise in the management and treatment of disability arising from neurological disorders, particularly multiple sclerosis. And we're going to be talking about some of the specific questions about physical rehabilitation in MS that you've been asking. But before we get to my conversation with Dr. Pilutti, there are a few other things that you should know about. Last week, during the American Academy of Neurology annual meeting, the National MS Society awarded the John Distel Prize for MS Research to Professor Ann Cross, for her early work on the role of B cells in driving MS immune attacks and her investigation of new imaging techniques to detect disease activity. Professor Cross is a professor of neurology and the section head of neuroimmunology, as well as the co-director of the John L. Trotter MS Center at Washington University School of Medicine in St. Louis. This was the 25th anniversary of the Distal Prize, which is given jointly by the National MS Society and the American Academy of Neurology. The Distal Prize was established by the late MS Society National Board member Oscar Distal and his wife Marion, in honor of their son John J. Distal, who lived with progressive MS. Professor Cross has made MS research the work of her entire career. She was the very first scientist to demonstrate the role of B cells in MS and continued her investigation into the role of B cells at a time when the research community was entirely focused on T cells as the main contributors to the onset and progression of MS. Dr. Cross's determination to continue her research eventually led to a transformational reconsideration of what we know about multiple sclerosis. Dr. Cross pioneered the first clinical trial of rituximab, which is a B-cell depleting therapy that ultimately paved the way for FDA approval of Ocrevus in 2017. This past week, there was some long overdue good news for people living with progressive MS in the United Kingdom. Reversing its earlier rejection of Ocrevus as an approved treatment for progressive MS, the National Institute of Health and Care Excellence reached a successful price compromise with drug manufacturer Roche and approved Ocrevus for patients in the UK who are in the early stages of primary progressive MS. Credit for this announcement was given to the thousands of people across the UK who strongly, loudly, and publicly advocated for the National Institute of Health and Care Excellence to reconsider its prior rejection of the drug. Roche estimates that around 2,700 people in the UK will be eligible for treatment with Ocrevus, which is administered as an outpatient infusion once every 6 months. In multiple sclerosis, parts of the central nervous system become inflamed, which leads to demyelination, which leads to disability. And researchers at the Pasteur Institute in France may have identified a piece of the puzzle when it comes to understanding the cause of that inflammation in the central nervous system. They found that human endogenous retroviruses, also called ancient viruses or fossil viruses, are involved in the central nervous system's defensive response to multiple sclerosis. These ancient viral sequences have been present and have evolved in our DNA over thousands of years, and while they lie dormant in most people, the scientists at the Pasteur Institute claim that these ancient viral sequences resurface and are active in MS patients. We'll have to wait and see how this new discovery of some very old viruses might help scientists solve the mystery of MS. I talk a lot on the podcast about the importance of advocacy. I believe that words have power and that advocating on your own behalf is empowering. And that's really another way of saying that if you choose to advocate on behalf of people who are affected by MS, you could actually feel better. Now, advocacy may not cure MS, but I believe it absolutely will make you feel great about your efforts to raise awareness, influence legislation, and be a part of the army of MS activists who are committed to doing their part to ensure that everyone has access to quality, affordable health care. Now, over the past 2 years, I've called out the Republican Party and the Republican members of Congress who seem hell-bent on repealing the Affordable Care Act, otherwise known as Obamacare. As the Trump administration's Justice Department is actively seeking to have the Affordable Care Act declared unconstitutional, I've derided the Republican Party for failing to offer a constructive alternative. I've reported on the patient organizations and the medical associations that have almost unanimously reminded us about the importance of protecting people living with pre-existing conditions, people who would lose those protections if the Affordable Care Act was repealed or otherwise eliminated. And that very large group of people with pre-existing conditions includes every single person living with MS. In spite of the politically polarized playing field that exists in America today, I really try to keep our conversation about healthcare as nonpartisan as I can. So I want to make sure that I tell you about a bill that's been introduced by Republican Senator Thom Tillis of North Carolina and endorsed by 22 other Republican senators. This bill would prohibit an insurance company from denying coverage to anyone because of a pre-existing condition. And in the House of Representatives, Republican Representative Greg Walden of Oregon has introduced a similar bill called the Pre-Existing Protections Act. Now, while both of these bills would provide some protections for people living with pre-existing conditions, these bills also contain other provisions that could prevent people with pre-existing conditions from actually getting health care. For instance, the bills don't indicate which benefits must be made available to people with pre-existing conditions. And these bills would allow insurance companies to go back to their old practice of charging women more for health insurance than they charge men. As a matter of fact, these bills allow insurance companies to charge different people different amounts for the exact same coverage. So while the Affordable Care Act prohibits insurance companies from charging higher prices because a person may have a pre-existing condition, these new bills allow insurance companies to charge any amount to extend healthcare coverage to people with pre-existing conditions. And while the Affordable Care Act imposes annual and lifetime limits on out-of-pocket medical expenses, well, these bills don't put any sort of cap on these expenses at all. These are the expenses that can absolutely drive a family's finances straight into the ground, as it did mine. So let me say this again, just so there's no confusion. The bills proposed in both houses of Congress by Republican senators and representatives require that insurance companies extend health care coverage to people with pre-existing conditions. And then these same bills allow the insurance companies to charge as much as they want for you to purchase that coverage. Now, to people living with MS and every other pre-existing medical condition, these bills don't come close to offering the same protections as those found in the Affordable Care Act. They don't offer the same access to health care. But what they do offer is political cover, because now, as we head into an election year, Republicans in Congress can truthfully tell their constituents that they're sponsoring legislation that will require insurance companies to offer coverage to people with pre-existing conditions. But if you want to really know how these legislators feel about people with pre-existing conditions, you just have to keep reading the details in these bills to understand how much worse off people with pre-existing medical conditions would be if these bills were to become law. And I'll say it once more. This is not intended as a partisan rant, but I promise that between now and the 2020 election, I will try to do my part to remind you about which legislators, which political parties, and which candidates have your best interests at heart and which ones don't. And when you talk about what's in the best interest of people living with MS, well, the thinking about exercise and physical activity has really changed. Several years ago, exercise wasn't recommended for people living with MS. But that's changed as researchers have learned more about how physical activity affects MS. Today, there are a lot of good reasons to make sure you're including physical activity in your daily routine. And in a moment, we'll be talking about how you want to be thinking about exercise and why you want to be thinking about exercise with my guest, Dr. Lara Pilutti, an expert in the role of exercise in the management and treatment of disability arising from multiple sclerosis. Dr. Lara Pilutti is an expert in the role of exercise in the management and treatment of disability arising from neurological disorders, particularly multiple sclerosis. Dr. Pilutti is at the University of Ottawa School of Interdisciplinary Health Sciences, and one of the reasons that I was anxious to talk with her is that she's not only looked at how exercise can benefit people living with MS, but her work has also focused on examining adapted exercise among people living with progressive MS. Welcome to the podcast, Dr. Pilutti.
Thanks so much. Glad to be here.
So I thought we could start our conversation by creating a little context. What do we know about the effect of exercise on people living with multiple sclerosis?
So we've really come quite a long way in the last 15 to 20 years or so. As I'm sure you know, and probably many of your listeners know, there was a time when we were concerned for people participating in exercise in terms of whether or not it would make our symptoms worse, whether or not it would, cause a flare-up or have more fatigue. So we now have some pretty good data that supports the safety of exercise for people with MS, as well as a lot of benefits for various different functions. So improving things like mobility or walking, improving our balance, improving fitness, symptoms like fatigue even. One of the key limitations, though, I would say, in terms of this evidence that we have so far, is that a lot of it is really focused on people with relapsing remitting MS rather than those who have the progressive form of the disease, as well as those who are at the lower end of the disability spectrum, or people who may not be using any type of device or assistance to help them walk and get around throughout the day.
You know, that really brings me to my next question, something that I get asked a lot by several of our listeners, because we talk about exercise and MS pretty frequently. But when we do talk about people living with MS who are exercising, I think that a lot of people who are living with progressive MS wonder if the conversation applies to them. So tell us, does it apply to them? And if it does, how?
Yeah. So a lot of the research from what we know so far, like I mentioned, it's focused on people with relapsing MS, or it's combined interventions where people have both relapsing or progressive. So we haven't quite teased out those effects independently. We do have a small handful of studies that would suggest that there are probably some similar benefits from what we see in the MS population overall that can be applied and for people with progressive MS. And there's a lot of trials that are focusing right now that are ongoing and really recruiting people with progressive MS exclusively when it comes to exercise. So that'll be really interesting in the next 5 years or so to see what the results are of those studies.
So for people who are living with progressive MS who are listening to us today, and they're ready to up their game when it comes to fitness, are there steps that they can take now, or should they be waiting for more data?
No, I think that exercise is generally safe for most people. We know that from a lot of different types of research. So I don't think that people should wait or be hesitant, and starting small if they're new to exercise, kind of gradually getting into it, seeking out some advice from an exercise specialist can be a great way to get started. And there can likely be a lot of benefits there. So I would say don't wait, though.
People who don't have MS, but who also don't exercise or pursue any kind of a fitness routine, we know that they're more apt to develop health-related problems. And people living with MS, well, they sometimes feel like multiple sclerosis is enough of a health-related problem to focus on. So they don't always think about pursuing wellness activities as a means of warding off other potential health-related problems. They sometimes settle into a more sedentary lifestyle. And I'm wondering if you can talk about the additional health risks that someone who's living with MS might face by choosing a more sedentary lifestyle.
Yeah. That's a really important point that you bring up. And we do know, as you mentioned, in kind of the general population, those risks of not participating in regular activity and movement. There's been quite a bit of research looking at comorbidities in people with MS. So in addition to your MS, all of the other conditions that you might be having that are not necessarily related to MS, but are conditions that are happening at the same time. And there's been a lot of focus on those that are cardiovascular, so like heart disease, as well as metabolic conditions like diabetes. There's a little bit of discrepancy in terms of the literature as to whether or not there are higher rates of some of those conditions in people with MS. Some people would suggest that there are. But what's really important is that what we do know is when people with MS have those conditions, particularly those like heart conditions and diabetes, it can increase the rate of disability progression. So that can have a huge impact on how someone might experience the disease and how fast their disease progresses. So it really is quite important.
That sounds like a really important wake-up call. As someone develops these comorbidities, not only do they have new things to be concerned about, but their MS is also likely to progress more rapidly, and so they have lots more to worry about, in other words, yes?
Yeah, and that can be really challenging. So I can totally understand how that can be overwhelming, and starting to think about some of these other maybe lifestyle-based approaches in addition to managing the disease can be certainly very challenging. One of the nice things about exercise as an approach, rather than kind of we think about our pharmacological therapies that are more targeted at certain symptoms or certain outcomes, is that exercise has this great benefit in affecting all of our different systems in the body. So not only can we see some of these other benefits that I mentioned earlier, like mobility or balance or fatigue, but we're now starting to look at, can we also manage those risk factors for those comorbid conditions where we know in the general population that exercise is certainly effective for reducing our risk of things like heart disease and diabetes and weight management or other conditions like that.
For people who are living with MS and are interested in getting involved in fitness-related activities and getting involved in exercise, but they're also a little concerned. They're a little worried because maybe they're living with some balance issues that might make exercise a little more challenging. So they don't want to necessarily run down to the gym at the corner and start trying to work out. What should their next step be to do this a smart way?
That it certainly can be challenging, and just becoming a bit more active doesn't always mean that we have to, go to the gym and follow a very prescriptive routine. So one of the first ways to maybe get started is just to think about kind of your lifestyle and things that you do every day, how you might change things up a little bit within the context of your routine to move a little bit more at home and within, the safety of that type of environment where you may have other things that you can hold on to for a little bit of balance while you practice certain movements and work on, could improve things like strength and that might help to improve mobility and balance as well.
So when you approach physical activity, you don't necessarily want to do something that is going to take you outside of your comfort zone, but rather stay in that comfort zone and find ways to get extra support and balance, get something to hold on to or help support you in other ways so that you're able to work out or exercise or complete that activity while staying safe, yes?
Sure. I think it's a balance, just like anybody who's starting an exercise program. So we're just trying to be a little bit more active. We want to, increase those activity levels above where we are right now. So you want to challenge your systems and challenge your body, but we don't want to do too much too soon and have any risks for injuries that might set us back. So lots of different approaches that we could use. I know lots of people who have used different types of therapies at home with, resistance training bands. If they have more limited mobility, that could be something to do at home, or other people do like to do activities in the community outside of the home as well that might have some adapted types of exercises.
Dr. Lara Pilutti, I want to thank you for the work that you're doing to raise awareness of the benefits of exercise in better managing everyone's MS symptoms, perhaps slowing disease progression, warding off some of those comorbidities that just kind of complicate things all around. And thanks especially for the work that I know you're doing in working with better understanding how exercise is going to best impact people with progressive MS who are a group that are sometimes feeling a little overlooked and maybe underserved when it comes to discussing the importance of physical activity. So I appreciate all the work you're doing there. And thanks for taking the time to talk with me today.
Of course. It's great. Thank you.
Well, that's going to wrap up this episode of Real Talk MS. Please take just a couple of minutes this week to let me know why you'd be the perfect special guest for me to interview on our 100th episode. Just head over to realtalkms.com/enter, and you and I might be having a conversation soon on Real Talk MS episode number 100. I'm John Strum. Thanks for listening, and we'll catch you next time.